Hello everyone, my name is Shreyas Konde, second year MBBS student, Dr. Ullas Patil Medical College, Jalgaon. My topic is antidiuretics. Antidiuretic hormone, vasopressin. Vasopressin is a peptide synthesis in the supraoptic and paraventricular nuclei of the hypothalamus and stored in posterior pituitary. The two main physiological stimuli for ADH release are rise in plasma osmolarity and concentration of ECF volume. ADH receptor are G protein coupled cell membrane receptor. Two subtypes V1 and V2. V1 receptor are the all vasopressin receptor except those on renal collecting duct cell, thick ascending limb of loop of Henle and vascular endothelium of V1 type. These are further divided into V1A and V1B subtype. V2 receptor are primarily located on principal cell of collecting duct in the kidney and regulate their water permeability through ATP production. Then we see action of ADH. On blood vessel, it causes vasoconstriction. On GIT, increases peristalsis. On liver, glycogenolysis. Platelets aggregation. On CNS, release of ACTH from anterior pituitary. Collecting ducts. Increase water reabsorption. Vascular endothelium. Release of clotting factor 8 through vascular endothelium. Antidiuretics divided into three classes. First is ADH analogs, second is nitriuretics, third is miscellaneous. In ADH analog, there are three drugs: desmopressin, lipressin, terlipressin. In nitriuretics, thiazides and amilorides. In miscellaneous, carbamazepine, chlorpropamide, indomethacin. Vasopressin analog. The first is desmopressin. It is selectively V1 receptor agonist and is more potent than vasopressin as an antidiuretic. It has negligible vasoconstriction action. It is administered oral, nasal and parenteral route. Lipressin. It acts on both V1 and V2 receptors. It is less potent but longer acting than vasopressin. It is administered parenterally. Terlipressin. It is a product of vasopressin selectively V1 action. It is administered intravenously. Vasopressin antagonist. Tolvaptan. It is oral active non-peptide selectively V2 receptor antagonist. It increases free water clearance by kidney and help to correct the low plasma sodium level. It is introduced for the treatment of hyponatremia due to CHF, cirrhosis of liver and syndrome of inappropriate ADH secretion. Thiazides. Amiloride. It is a drug of choice for lithium-induced nephrogenic diabetes insipidus because along with blocking entry of sodium in the principal cell of collecting duct, it also blocks lithium entry. Chlorpropamide. It is long-acting sulfonylurea oral hypoglycemic found to reduce urine volume in diabetes insipidus. Carbamazepine. It is an anti-epileptic which reduces the urine volume in diabetes insipidus of pituitary origin, but mechanism of action is not clear. Let's discuss about MCQ of this topic. The first is, which of the following are not vasopressin analog? The options are desmopressin, lipressin, terlipressin and tolvaptan. The answer is tolvaptan because it is a vasopressin antagonist. Which of the following are not thiazides? Options are amiloride, chlorpropamide, carbamazepine, terlipressin. The correct option is terlipressin because it is ADH analog. V2 receptor are primarily located on which site? Options are DCT, PCT, loop of Henle and collecting duct. The answer is collecting duct.